If you aren't living on the edge, you're taking up too much space. It has nothing to do with thrill seeking. It's about making the most out of every moment, about stretching your own boundaries, about being willing to learn constantly and putting yourself in situations where learning is possible, sometimes even critical to your survival. Being out on the edge with everything at risk is where you learn and grow the most. When my grandfather started this pharmacy in 1882, the soda fountain was a draw. Even then, he knew that pharmacy was about people and about taking care of people. Back then, you could have held all the drugs that were commercially available in both my hands. Now, there are over 10,000 prescription drugs that are commercially available. There are over 300,000 over-the-counter medications. How are we going to handle this? How are we going to keep this organized and keep on top of this for the healthcare industry? How are we going to help our patients with this? What is the draw? The draw that we bring is value. Value, that's what we bring to patients, and that's what we bring to payers. Healthcare is changing rapidly, and so is independent pharmacy practice. You told me 5 years ago that you couldn't handle reimbursement cuts, yet the cuts have continued to come. How have we handled it? We've handled it because we're versatile. I guess you could say that pharmacy is the Swiss Army knife of healthcare. We have to be coaches. We have to be listeners. We have to be investigators. We have to be planners. We have to be great communicators. Do we want to be paid more, or do we want to be paid differently? I don't think they're going to pay us any more for doing the same thing, but I think they will pay us differently for bringing them value. We have to get out on the edge. We have to learn. We have to grow. We have to rethink pharmacy. Change, something that sometimes brings fear to all of us. A lot of people would say, I would rather be riding the wave than caught in the tide. But I think maybe we should be creating the wave instead of surfing it. This change that we talk about, it's inevitable that it's going to come. We've got star ratings facing us. Star ratings invoke fear in a lot of us. And maybe they should invoke fear in us, because they're not really the end to the game. They're just a part of the game that makes us think about quality and what we need to do to change. We need to rethink pharmacy. That's where we need to be. The core issue here is that we simply can't afford healthcare anymore. It's gotten too expensive for us. So we have to start thinking about value, because value is the only real solution versus cost shifting or restricting services. I want you to know how to connect with patients, how to connect with healthcare providers in your community to get a real clinical and business return on investment.
1866 here change.
Thanks, Felipe. You have a good day.
Appreciate it. You too. Take care.
Man, I love a good cup of coffee. You get the right bean, right barista, and you end up with a cup of quality. That's where we need to be in pharmacy, in the quality business. It's not about who can put the pills in the bottle fast, accurately, and cheap and deliver that to the right patient. It's about the outcomes that we can give that patient by putting those pills in that bottle. We need to get away from this pill-centric model and go to a patient-centric model. Let's think about the patient that walks into our pharmacy with a prescription that says metformin, number 90, 1 tablet 3 times a day. Hemoglobin A1C 13.5 is written on the prescription. Patient walks in with the same prescription, metformin, number 90, take one tablet 3 times a day, 500 milligrams, but it says hemoglobin A1C 7.5 on the prescription. The conversation we have with these two patients are completely different. They don't resemble each other at all. But what we really have today is we have that prescription that walks into our pharmacy, metformin 500 milligram, number 90, take one tablet 3 times a day with no hemoglobin A1C on it. So we end up delivering some generic message that's not tailored toward the outcome. And that's what we get. We get generic outcomes. So what we need to be is quality focused and outcome focused on this. So if quality is our new focus in pharmacy, how do we increase the quality of our patients' lives? How do we increase the financial outlook of our pharmacies? In other words, what does this clinical community pharmacist look like? Well, they're chronic care oriented, an integral part of our healthcare team. And they utilize technology, deliberate and intentional in their marketing. That's what we need to be great clinical community pharmacists. So, let's begin with the thought that the clinical community pharmacist is chronic care oriented. We have an incredible problem in the United States with 1 in every 3 adults having prediabetes. How are we going to deal with numbers like that? How are we going to handle the challenge of that disease state alone, not to mention other disease states? We have heart failure, COPD, and many more disease states that we'll address in this continuing education problem. So you've got a patient that has a hemoglobin A1C of 13% and they're taking their medications correctly, yet they're still not under control. How will we coach that patient through that problem? How will we work with the healthcare team? Well, this clinical community pharmacist is an integral part of the healthcare team. I remember a number of years ago, I used to go to every physician meeting out there, and I would tell these doctors, send me your worst patient. Send me that patient that everybody in your office knows by name because they're in there all the time. And this went on for a year or so. And finally, I got a couple physicians to send me those worst patients. And I took those patients into our pharmacy and put my clinical team on them, and we did great work coaching these patients. And what we found out we failed. But we couldn't do it because it's not a pharmacy problem. It's a healthcare problem. It's a team problem. So what we found out is when we started partnering with others out there, we started partnering with doctors, partnering with nurses, home health, we found that then we could make a difference. We partnered with the family of the patient. We partnered with that patient. We partnered with parish nurses. Every entity that came along and touched that patient in the healthcare spectrum, we tried to partner with them. And we found out that that's how we started making a difference in the outcome. With 1 in 5 Americans who are hospitalized become rehospitalized, that's a huge number, and that's a huge opportunity for us in pharmacy today. That's an exciting opportunity out there for pharmacy. In this state, the average patient has 3 visits a year with their primary care physician. They have 9 visits a year with somebody else in healthcare like home health, a specialist, physical therapy, but they have 35 visits with their community pharmacy. 35 opportunities that we have to reinforce that care plan a year. That, my friend, is what we need to be leveraging in healthcare. That is our opportunity in healthcare, are those 35 potential touch points we have every year to reinforce this healthcare plan. If we're working on population management, we're not just worried about that patient that's in our pharmacy today, we're worried about the patients that are not in our pharmacy too. We're worried about all of our patients and how we can treat that population of patients and get the best outcomes for them. I want you to tell me at hashtag Rethink Pharmacy on Facebook and Twitter your innovative ideas about how you connect with patients. I want to tell you to tell me how you collaborate with patients at hashtag Rethink Pharmacy on Facebook and Twitter. Of course, this begs the need for technology. We have to embrace technology. It's here and it's changing every day. The clinical community pharmacist is really in tune to where technology is. There's one pharmacy using FaceTime to connect with patients in their own home to educate them. There's another one using FaceTime to connect with providers and to collaborate on patients. We've got pharmacies out there that are into the electronic medical records, and they're documenting into the electronic medical record. We've got pharmacies out there that have a platform that they can communicate and document and send messages to home health agencies and care managers that are in the home. And they can also bounce those messages back to physicians. So the technology piece is something we can't forget. Finally, it would be a shame if all these clinical community pharmacists could do all these great things with adherence, all these great things with connecting with patients, and all these great things with collaborating with physicians, and yet no one out there knew a thing about it. It's like the artist who sits at home in their studio and paints masterpiece after masterpiece and then puts it in their closet, and no one ever knows about how great they are until they die. We don't want that to happen to pharmacy. We want pharmacy's story to get out there. We want everybody to know the great things that pharmacies can do and pharmacists can do to help healthcare, to reduce total healthcare costs. So tell me about your innovative ideas and tell me the great things you're doing at #Rethink Pharmacy. #Rethink Pharmacy.